I'm Dr. Justin Bryant, and I'd like to tell you a little about a form of scalp reconstruction that I use after trauma and cancer resection. Scalp expansion is a unique reconstructive technique that creates new scalp tissue, allowing us to reconstruct areas of alopecia or baldness on the scalp. This technique is not the same as hair transplantation. By slowly expanding the surrounding hair-bearing scalp, the scalp is not simply stretched, but the skin cells within the scalp actually begin to divide, creating more hair-bearing scalp that can be used for reconstruction. During this process, an expander, which looks similar to an empty balloon, is placed beneath the hair-bearing scalp. This expander is slowly inflated in order to stretch the scalp tissue containing hair follicles. This slow stretch causes those cells in the scalp to divide, creating more of the hair-bearing scalp needed for reconstruction. Expanding the scalp to create additional tissue also minimizes tension on the scalp at the time of the final reconstruction, resulting in thin, well-concealed scars. The process of scalp expansion involves an initial expander placement surgery during which the scalp tissue expander is placed beneath the scalp. This is followed by a period of expansion. A final stage surgery completes the scalp expansion process. During the expander placement surgery, a tissue expander is placed beneath the hair-bearing scalp. In my practice, I use a minimally invasive technique in order to place the empty tissue expander using a few small incisions placed far away from the area of expansion. This allows me to reduce the risks that may be commonly associated with scalp expansion. After the expander is placed, scalp expansion usually starts around 2 weeks after surgery. During the expansion process, an external expansion port connected to the expander is used to add saline fluid to the expander over a period of weeks in order to slowly stretch the scalp. Initially, expansions are performed once or twice per week in my office, but you may be able to progress to doing tissue expansions at home with the help of a friend or family member. The expansion process typically takes about 3 months. After the goal expansion is achieved, the scalp is allowed to relax at its expanded size for about a month before the final stage surgery. During the final stage surgery, the tissue expander is removed, the area of alopecia or baldness is excised, and the expanded hair-bearing scalp is moved into position to reconstruct the area of alopecia or baldness. In this patient, the expanded scalp was used to not only reconstruct the area of alopecia, but also to perform a forehead reduction surgery with an aesthetically pleasing result. Scalp expansion can be performed for areas of alopecia of varying size in any location of the scalp. As you can see, this unique technique of scalp expansion allows us to provide reconstruction of the hair-bearing scalp with thin, well-concealed, nearly imperceptible scars. Thank you for joining me to learn about this unique form of scalp reconstruction. Please follow or subscribe to learn more about various types of reconstructive surgery.